So greetings to all, whosoever is watching us from anywhere. Today, we have got Dr. Neha, who is a medical practitioner in US since last approximately 20 years. Dr. Neha journey is ideal for all the students in US or out of India, especially for the reason that Dr. Neha, the path that she has pursued is something that everyone would like to pursue, whosoever is in the medical field. For example, we keep on receiving the calls, the mails from the parents that what after NEET, right? Especially for those who have to go to US, having done NEET here in India, having done MBBS here in India. So we could finally get Dr. Neha with us. She has cracked USMLE. She's in US, has been practicing this over there, medical, since last 19, 20 years. So this is it. So Dr. Neha, welcome to the TestprepKart.
Thank you so much. Thank you for having me here.
Thank you, ma'am. So the thing is that whatever you are talking, each and everybody is going to be important over here because the students from all over the world, whether they are in Middle East, whether they are in Southeast Asia, whether they are in US or Europe, whether they are in India, they would just listen to you and they would be following your words, right? So this is our show, Being Candid with Dr. Neha. That's it. So this session basically is going to focus upon the USMLE part, right? But before that, ma'am, we would like to know something about you.
Oh, so I moved to the US in 2005 after my MBBS from India. So I did my MBBS at BJMC Pune, and I've been here since 2005. So I came here. I enrolled in a Master's of Public Health for 2 years, and I completed my last USMLE steps during that period of time, and then went through the residency interview process. And then I chose to be an internal medicine physician. That is what I wanted to do, internal medicine, and then nephrology subspecialty fellowship after that. So I'm now a practicing nephrologist. I've been in practice for over 13 years, and I'm very happy that I made this move. So I actually encourage all of you students to consider this path and kind of learn about all the specifics that are needed.
So, ma'am, when did this idea of pursuing this USMLE and then just to come to US? Because of course, the time that you mentioned, 2005, was basically a conservative time, right? When the things were opening up, okay, definitely migrating from India to US was not a problem, but definitely for the field of medicine, that also gives you a very wonderful scope here in India just to practice and then to pursue a career, right? So, ma'am, when did this idea come to your mind that you have to write this USMLE and you have to settle in US?
So during my MBBS year number 3, a lot of my fellow colleagues, my friends, they had started preparing for the USMLE. Part of the reason also being in India, your PG medicine seats are very limited. So when it comes to the clinical subjects, the actual clinical subjects like medicine, surgery, pediatrics, OBGYN, they're not enough postgraduate seats. It's just because there's so many students. So you have to sort of keep all of your options open, and US was one of them. It was just to sort of expand the scope of being able to do medicine later. So I started kind of finding out more about USMLE, other options, when I was in my medical school, class 3, year 3.
Right. So, ma'am, when did you start preparing for USMLE?
So in my case, I think I was a little bit delayed. The ideal time to begin preparation is actually with your MBBS studies, because the way the USMLE exams, these are the US licensing exams, they're actually structured according to the US medical school's curriculum. So whether it's here or whether it's in India, the curriculum, the overall content is exactly the same and the structure is the same. So the first 2 years, whether it's in US or in India during your MBBS, the first 2 years are exclusively dedicated towards your basic fundamental courses. So these are courses like anatomy, physiology, biochemistry. pharmacology. So these are your foundational courses where you're not seeing the patients. The first 2 years are strictly in classroom courses. And that's what USMLE Step 1 is based on. So USMLE Step 1, it's essentially your test, which will test you on these foundational subjects. So
Right.
the best time to take your step 1 then is in your medical school year 3, because you're fresh from all the courses, you just recently studied them. So that's the best time because you're already prepared.
Ma'am, there are two things over here. In fact, two cases.
Yes,
One, that a student is in US,
yes,
would be coming to India, would do MBBS and would be writing USMLE.
yes,
That's a natural choice. That's the
yes.
first case. Second case is that one a student. Second is that the student is here in India, right?
Okay.
And he has to go to US having done USMLE, right?
Yes,
So your case was definitely belongs to the second case study, right?
that's
So
correct.
ma'am,
Yes.
when you took this decision, what was
Yes.
the reaction of your parents? What the thinking that you are going far from them for studies? Was it really a concern for your parents? What was their reaction? Because here in India, being a girl child, right, ma'am,
Yes.
at the age when you are supposed just to do this glorious MBBS and then to pursue your career over here in India, you took a revolutionary and a path which is not taken by all, right? Most of the people that thought that you won't be India, you'll be going to US. What was the concern? What was the reaction of your parents?
So at that time, again, it was not just me. I had a few fellow batchmates, my peers, who were also in the same situation. They were
Right,
also preparing for their USMLE exams, like intending to come to the United States with the exact same intention. And that kind of happens like everywhere. So no matter which medical school you are at in India or in the United States, because all of your peers are in the same situation, you will always find like at least a few people who also, like, in a way, they're not just your peers, they're also your mentors, because you share a lot of information with each other. And that's how
right,
you kind of get all of your information about your future housing, the expenses, and sort of a game plan, like what to do, what not to do. So I think that was very reassuring for my parents, because I was already in conversation with some of my medical school seniors who had already come over to the United States. So I was in
right.
conversation with at least 5 or 6 of them, who then were mentoring some of our junior students in India. And then I was in contact with my peers who were planning to do the same thing.
That's great. So USMLE, when we talk about this, it is divided into some steps. So when did you start your step one preparation?
So I started my step 1 preparation a little bit late in my medical school year. But like medical school, it's a busy program. So you have to attend a lot of classes in the first 1 2 years of year 1 and 2. And third year onwards, your clinical rotations begin. So once you're in the hospital, starting from your year 3, then it gets really busy. So you need to structure, you need to time your steps according to your curriculum. So the best time to take USMLE step 3 is when you've immediately completed your medical school year 2 exam, because
Hmm.
those are all the same courses that the step 1 will test you on. So your preparation time will be a lot less. You will not need more than a month at most, because it's exactly the same material. Now for step two actually tests your clinical skills. So that will test your diagnostic skills and how you come to a particular diagnosis about a case. So for that, you need to have some clinical background. And that is what your MBBS year 4 is. So you're essentially your entire year number 4, year number 3 and 4, they are all clinical rotations in the hospital, where you'll be going for your medicine courses, your surgery courses, your gynecology, orthopedics, pediatrics. So these are your clinical courses. And that is what your step 2 course curriculum is based on these clinical rotations. So the minute you've completed your clinical rotations, then you're in a very good frame to just go through your step 2. So the step two ideally should be done immediately after your MBBS final exam. So when you've completed your MBBS final, you get some time off. You have time again at that time to prepare for your step two.
Great. So, is there something special in step two? How does it differ to step one?
So both of them are computer-based exams. So it differs a little bit from your MBBS because MBBS is a written test. And I think it's a lot more rigorous in the sense they go into a lot more
When we
deep.
talk about MBBS,
Yes.
basically, it is all about demonstrating your aptitude in three subjects: physics, chemistry, and biology, right? Even for, I mean, these days, I mean, all must know that the government of India,
Yes.
uh, I mean, English is the medium, okay, which is
Yes.
supposed to be the best. But the government has also started the Hindi, Marathi, Gujarati, and all these, regional languages. That's it. So we can say that, having spoken with the students from India, that physics, chemistry, and biology, of course, it has got a different language. So one may not be so good at English, but if he's good at physics or chemistry or biology, he would be able to crack this NEET. That's it. I would also like to say that in year 2024, there's a girl from Maharashtra, right? And she's the topper. She has got 720 on 720, and
Okay.
she has her medium of study not English but the regional language. That's it.
Yes. And that's very true because even in our MBBS class, there were students who came from the vernacular schools. So they had done it was AIPMT at that time.
Yes,
That is
yes,
what NEET was called in the
yes, yes,
past. So they had actually given their AIPMT in their regional language, and then they had come to our MBBS class.
right.
I though would say it was a little bit difficult because all of your MBBS material, all of your MBBS course curriculum is actually in English.
Hmm.
So in that first 6 months, it was a big learning curve for them because they had to essentially convert to all the English books for your MBBS.
So USMLE, what basically is USMLE? What is the construct, the design of the paper? What USMLE is all about, man?
So USMLE, again, this is the equivalent of your MBBS exams where it tests your knowledge that you've acquired in your medical school.
Right.
So all the steps, these are computerized tests in a MCQ format. So the format is multiple choice questions for each question, multiple choice answers for each question. And it's divided into 7 blocks. So your USMLE step 1, it's an 8-hour exam. You have 7 blocks of 1 hour each. And I think each block then would have a certain number of questions, probably around so like around 250 to 300 questions divided in those 7 blocks. And it is also a time test. So for each block, you get exactly 60 minutes. And that is how all the steps are structured. So step 1 is like that. Step 2 is exactly the same way, where it's again an 8-hour test, 7 blocks of certain number of questions each, and they're timed. Like the block will finish at 60 minutes. Like then if you still have some questions left, once the timer is up, you will not be able to answer them.
Right. Right. That's it. So, ma'am, coming to a very interesting part of the conversation,
Yes.
the planning for USMLE, Dr. Neha's planning to approach and to attempt USMLE. Right, ma'am, that's the thing. Let me tell you, you have left India 20 years ago. You are
Yes.
completely engrossed now into the culture of US. That's very systematic, calculated, right? It's not a lot of hue and cry, right?
Yes.
That's it. Here in India, you shall be finding the things quite cynical, right? There is a lot of rush for every opportunity. Even if,
Yes.
I mean, we sometimes get into metro and find that even for a single seat, if someone has to sit, right, people will rush towards that for one
Yes.
seat. That's it. That's the fact of a typical life here in India, right? That's it, man. So here in India, when you are talking about JEE, Joint Entrance Examination for all ITs and ITs, triple ITs, right? There is planning, rigorous
Yes.
planning. I have to
Yes.
start from grade 8, some 6, and some from grade first, right? I have heard, right? Similarly for the NEET, though NEET is taken, in a little different way.
Yes.
People generally start from grade ninth or definitely from grade 11th or 12th, 1 year, 2 year and all, right? One
Yeah.
year, 2 year, right?
Yes.
That's it. If you are going for management, there are 23 All India Institute, Indian Institute of Management, you write CAT. If you are planning for UPSC, for civil services and all, you are planning, right since grade 12. I mean, going for Indian polity, economy, Indian constitution and all.
Yes.
So looking into all these stuff, which are quite subjective, one would be requiring a lot of planning.
Yes.
Is such type of planning, intense planning, minute planning, do you think it's required for USMLE? If it
So,
requires, what was your way?
so for the USMLE, the first thing is you have to be in a medical school. So that should be your priority first, is getting into a medical school. And then once you are actually going through your medical school, then the first year is like kind of getting used to all of your medical school courses, because now you're in a professional school. So you don't have the physics, chemistry, or mathematics anymore. The biology is very different. This is human biology now. So the course material is completely different from what you've done in your high school, in your 11th and 12th grade. So the first year is just getting used to all of that, is focusing on your medical school. And then for USMLE, most people, most students will begin preparation in their second year. And it's very different now because everything is so easy. Everything is app based. It's at the click of a finger on your phone. And there's so many nice apps now, which where you can access your USMLE question bank. And they're much more cheaper now. I actually had to get all
Yes,
these
sir.
paper
Lot of
versions of the.
content on net and all.
Yes, yeah. So that makes your preparation very easy for the USMLEs, because as you're preparing for your MBBS exams and courses, you can just start doing the question bank at the same time. So that will not only prepare you for USMLE, that will also broaden the breadth and the depth of your medical knowledge. So it will also help you in part for your MBBS exams. So they kind of go hand in hand. It's not like they're different. Your preparation goes hand in hand with your preparation for your MBBS course exams.
Ma'am, by planning, what I meant that I gave you 4 examples of engineering,
Yes,
medical management, UPSC and all.
yes,
So was it like anything that in order to write this USMLE,
yes.
did you also burn the midnight oil? I mean, studied for 11 hours, 12 hours, something like that?
Um, Not necessarily, because again, the material was very much similar to what you're already doing for your
Right,
medical school.
right.
So it's just trying to develop speed for the questions. So because these are time-based exams, the only problem you have is you may just take very long going through a particular case scenario, or you dwell so much on one question that you may run out of time. So that's the preparation you need. Like, you keep doing your question banks. And yes, I did spend, I took about like 2 months for each step. So 2 months of consolidated time prior to each step, where during those 2 months, I went through a lot of question bank material for that step. And then a lot of practice exams. So there are all these apps, all these, there was a paper version of those then at that time, where you could do a lot of practice exams and then score yourself.
Right. So, Dr. Neha, I would definitely love to ask this question to you. When we are talking about examination, and this is also something that we receive, this tinge of thing when they are preparing their NEET, their JEE with us in US, Europe, Middle East, and all. Is there any role of stress or anxiety in preparation of USMLE? How do you define that, man?
I don't think like there's no role of anxiety there. Like, it's again, once you're in a professional college, it's just a part of your curriculum. And again, you're not alone in this. So you'll have like at least a few, like 10, 15, maybe more students who are exactly in that same situation, who are also preparing for their USMLEs during that medical school. So you have a lot of support from your peers, from your colleagues. All the students, they should make an attempt to make a lot of friends when they are in their professional college and medical school. And that eases a lot of your anxiety, because if you have a good peer group, then all that anxiety is shared amongst your friends. And so there's no reason then to be anxious.
Your statement should definitely go to the heart and mind of all the parents who are hearing us through this video. Because they say that, okay, she'll be doing the MBBS, but USMLE, would she be able to crack? We definitely say that you have done MBBS, so USMLE should not be a problem for the child. That's
Yes.
it. So
Yes.
basically, Dr. Neha's statement is like a signature statement everyone should take and everyone should follow. That's it. So the thing is that, ma'am, my next question is that what was your experience? Which city did you get? And what work you were expecting to be?
I did not get the question in terms of city.
I
Like, what
mean,
did you mean?
yeah, having done your USMLE, which city did you get? I mean, which hospital, which medical institution did you get?
So after I completed my USMLE exams, there's a
Right,
process where you apply for interviews to all these various residency programs. So you have to
right,
submit an application to each of the residency program here. And I think I'd submitted about 30 applications to 30 residency programs. So I ended up matching, and that is what the final result is called, that you match at a particular program. So I ended up matching at Wayne State University. This is in Detroit. It's a big medical school, big residency
right. Yeah,
program,
yeah,
Detroit.
that's it. Great. So, ma'am, is it that if I'm not getting a good score in USMLE, can I reattempt it? And how many times I can reattempt it?
So you can so if you have a poor score, let's say on your USMLE step 2, step 1 you got an excellent score, step 2 not so much. So you can definitely repeat your step again to get a better score, because that's the computerized test where you can just redo the test again, and you're allowed about, I think, 3 attempts per each step. So you have 3 attempts. But let's say if you did not match in your residency, so you submitted all these applications and the result came and you did not match in a residency school. So then, of
Hmm.
course, you have to redo it next year, and there's no
Right,
limit on that. So you can keep doing that. You can only apply to all these schools. The match can only happen once a year. So you'll then be delayed to the next year and then the next year. So till you match.
right. Again, a very important time. How much time do you take to prepare for USMLE typically? I mean, what was your screen time?
So the screen time has to go simultaneously with your MBBS studies. There is no other way. So you have all your books, your actual theory material that you're going through for your MBBS exams, because that's a little bit more theoretical exam. And USMLE is a little bit more application based, MCQ format. So it's best that you start doing your question bank simultaneously, because then that will really reduce your extra preparation time. And the course material is the same. The only difference is the format of the exam. So, and now question banks are on the phone. So all you need is a smartphone and a question bank on your phone. And then let's say you have some time in between the weekend, you just need to like designate maybe a few hours each week, maybe whenever you're off or even during your rotations. There's so much of time in between, so then that ways you are not stressed towards the end. Your preparation has happened simultaneously.
Great. So, what did you do after the results, ma'am? What after the results of USMLE?
So USMLE step, once you have given your USMLE step 1 and USMLE step 2, these are the strictly computerized tests which can be taken anywhere in any country, whether you're in Europe, in India, in Middle East. So you take them anywhere. The US graduates, the US medical students, they also have to take that because that's mandatory for them as well. So the once you have done your step 1 and step 2, if you are in another country, the term is called foreign medical graduate. Then you are under that category of
Mhm.
FMG, foreign medical
Right,
graduate.
right.
So ECFMG here is the organization which maintains the data and the score reports and your licensing for the FMGs. So for anybody from outside, that becomes like your parent organization, the ECFMG, which is like the central board. So so that is done. You get your ECFMG certification for step 1 and step 2, and then you have to do your step 3. Now, step three is almost like your MBBS final exam, where you have, it's also computerized, the step three, but it has clinical case scenarios. So you actually are given a patient case where then you have to come up with the diagnosis, and like you have to also be able to interpret some research study, so that will involve some biostatistics interpretation of research study. So that is what your step three entails. And then it also entails an in-person viva exam where there are these simulated patients. So you actually have to go to a center, and that's your second step of, so step three is a two-step exam, like part one and part two. So part one is a computerized test, and then part two is where you actually go to a center. It's about, I think, 4 or 6 hour. It's actually maybe shorter. I don't recall exactly, but there are these people, simulated patients. These are the actors and the actresses who will be pretending to be a patient, and then you visit that patient's room, and
Right.
then you perform your clinical exam. So that's the part of the step three. So that can only be done in the United States. And then once you have completed your step three, then you can apply for your residency programs.
Great. Great. So, ma'am, here in India, currently the scenario is that the medical infrastructure I'm talking about, that the students who are out of India, they have to apply under this 15% of NRI quota or central pool of quota or all India. Right.
Okay.
Basically, these are the students who have a just to go to US and they have to crack it because they themselves have lived in a diverse society of
Yes.
Middle East, US, Europe, Tokyo, Singapore, and all. Right. So when they are listening this channel,
Yes.
they will have. I just wanted to know what would be your advice to the students who are scattered in 28 states in 760 plus government medical colleges, to the students who are in AIMS, in autonomous college, deemed university, deemed to be fit university, this big number of students, right? Currently, under this 15% of NRI quota, the students who are out of India, they can avail 15,500 seats for medical. So when
Okay.
they are in fourth year, they are in their final years,
Yes.
what would be your advice to them for this USMLE, the intern and all?
So once you again are, you meant fourth year of medical school? Let me clarify
Yes,
that,
ma'am.
sir.
Yes, here in India, the final year,
Okay.
fourth year.
The final year, fourth year.
Yes,
So at the time of your fourth year, you have to come up with a plan on how to travel to United States then, because your USMLE step three,
right.
the part one, the part two, that's the two-step exam, you can only take in the United States. So you need to make sure that you have a visa to.
That you are giving because most of them they think that having finished their MBBS, I shall be writing USMLE. But after speaking with you, now it is clear to me and then to thousands of others that USMLE 1 and 2
Yes.
you have to write by being in the course of MBBS, right, ma'am?
Yes. So
Great.
USMLE step one, you can do anytime. In your year number three, you are very well equipped for that.
Right.
And your step two, you can plan to do it during your final year, like immediately after your MBBS final exam, because you'll be very well prepared for that.
Great.
So, and again, if you're doing your question bank simultaneously, there's no separate preparation involved. So in your fourth year, fifth year, what your goal should be to focus on how to get to the United States, because you will have to take your step three in the United States. So those specifics then need to be figured out, is making sure that you have a place to stay here, a visa to come here, your timing of the USMLE step
Right.
three, and how you should time it with your residency application submission,
Hmm.
whether you want to do it in a single trip or whether you want to do it separately in two trips, right? So those logistics you need to start figuring out in your fourth and fifth year.
Okay. Great. So, ma'am, do we require just to make a CV, specific CV or short bio for USMLE? and
The
all?
USMLE does not require any CV because it's almost like applying for a test. The way you submit your NEET entrance exam form, it would be very similar to that, just your name, residential address, maybe just some demographic details. There's no CV required for that.
Right. So, ma'am, now the thing is that is there any cost, sufficient cost, which is associated with the USMLE? What is
So
that
each
cost,
of
ma'am?
these, yes, yeah. So USMLEs, unfortunately, they're not very cheap. Each of these steps, the approximate cost, I think, is $1,000 for each exam. So step one is close to $1,000. Same thing for step two. And I do believe step three is a little bit more expensive, probably around $1,500 because it's a 2-day exam.
Right.
And then for step three, you also have to be in the United States in person.
So, ma'am, which residency you went and what did you pursue once again, ma'am?
So I went to internal medicine residency, and after my internal medicine, so this is called MD in India, I went on to do nephrology subspecialty fellowship. So that would be similar to what we call DM in India.
MD.
So MD is the general
MD, which
term
comes
used
after
for,
MBBS. That's it.
yes. So
Ji.
MD medicine is the same thing as internal medicine residency.
Right. So that's it. So, ma'am, so articulately you interpreted this whole structure of USMLE. It's a pragmatic effect, the practical aspect without any hyperbole or understatement. And I'm sure that it must have now gone into the mind of the student, whatever you have interpreted, especially the way you have interpreted. Right. So we really, ma'am, are so thankful to you just to give
Thank
us
you.
because the truth is simple and you simply explain the things in a quite simple way, right? So that having heard you, having gone through this piece of video, the students who basically, as we told you, are the part of the case study two, case study one. I mean, the students abroad, they are coming to India doing their MBBS, and they have a just to return back to US, especially for USMLE, they are going
Yes.
to be benefited in an immense way through this talk and the way you have interpreted it, ma'am. Right.
Thank you.
TestprepKart, the whole family is so much so thankful for you just to give
Thank
her
you.
precious time. And ma'am, in future, should we require more, insight, we would connect to you. You would love to know that we have been producing a good number of results under this 15% of an RI quota since last 4 to 5 years.
Yes.
So those students would be blessed who just hear you and they take an insight from your talks and everything. Ma'am, thank you very much. And
Thank
thanks a lot
you.
from the whole TestprepKart family. Thank you, ma'am.
Thank you for having me here. And I'll just add this for the patient's benefit, for the parents' benefit, that I think there are so many other students who are in the same situation that it's not very worrisome actually. And it's good if your child is able to go out, be in an international setting, they learn a
Right.
lot more and they become a lot more independent. So as long as they
Right.
have a good peer group, I don't think there's anything to be very scared about. And medical schools in India are so structured that the student
Yes.
dormitories, they're very safe and they're really well looked after. I think that's the only background homework that the students and the parents should do. They should probably just go and check out some of the facilities before.
Right. Thank you very much, ma'am.
Thank
Thanks once again for your precious time. Thank you.
thank you for having me here. Thank you so much, Manishi.
Thank you, ma'am.
Thanks.
Thank you.